All right, good morning. Today is April 23rd, 2025, sorry. All right, and we have, and I do call this budget session to order. First up, we have Human Resources, and again, if this is your first time speaking, I do ask you just say your name and your title for the record, and we'll kick it off to you.
Meg Caton, Human Resources Director.
Thank you, Meg. All right.
Okay. My budget is fairly simple compared to some of the other departments. So there are just a few items this year that we've either added or asked for an increase. Okay. The first one is the Employee Assistance Program.
And if you are referring to the budget analysis or the summary detail, can you just start with the account number and then we can follow you.
Sure. So HR is $18,500, and then specifically employee assistance is $502,038.
Thank you so much, Ms. Caton.
Sure. So with the employee assistance, this is the program that employees have access to for assistance with mental health, financial assistance, things of that nature. And we have seen an increase this past year where employees have been utilizing it. So that's why we did ask for the additional monies in that account.
Okay. And this is beyond, so this is, can you get just a little more specific? Like, is it mental, what assistance?
More behavioral health assistance.
Behavioral,
yes.
Okay.
Yep,
That's
exactly.
Good. I know that last year, council allocated more funds for training. Did you all see, was it fruitful? Or?
Oh, yes, very fruitful, yes.
Okay. And which, remind me of that line item,
Training is...
I see it right here.
Yes.
55504.
Yes.
So that's level, 16,000. Is that...
Yes.
Is that enough? Is that...
Yes, we're keeping it right within. Yes, okay. That's been very helpful.
And then just, if you don't have anything else in this particular, I have one more question about, so the wellness. I know we had a question about that last year. I do see that is zeroed out. Are you all canceling that program or what's going on with that?
I believe that to streamline the process, that has moved to the mayor's office, I believe.
Okay.
Correct.
Gotcha. So you all would not...
Honestly, the mayor's office typically dealt with it anyway. It just lived in my account.
Yeah, so Jesse has been the person who's been managing the Thrive initiatives. So you'll see both wellness and then it said employee picnic. There's two line items that lived in HR. We consolidated them. Those are now in the mayor's budget.
I do have so this is where, my brain as a corporate brain goes. So we have a couple different, and this reminds me of yesterday with PD. I know they have, we just allocated, or I think it was in you all's mayor's proposed budget for the 40-ish thousand for their program, for their wellness. And then we have one in HR, and then it looks like we have a couple different pockets for employee wellness, which is important, but this lives in a couple different accounts. So, why is this not consolidated into HR? Or, we have now a wellness account that's 12.5. We have employee assistance that is this dollar amount here. It just seems like we have a couple different accounts that are doing sort of the same thing. Should we streamline this, or should we, is this?
It might not be a bad idea to streamline it.
Right.
Considering we are trying to streamline some other accounts.
Yes. And I don't know if, council, that makes sense to you all, but it just seems like we have a couple, this is like the third or fourth employee wellness or assistance accounts. Sure. And it's not congruent. And in my brain, I think HR should be, taking the lead on this effort in these assistance programs. That way we know, we can track how this is working for the city.
Sure. Employee Assistance Program, the EAP, is a slightly different program that is, professional assistance outside of it. Our office, the wellness programs are internal activities that we do with staff and stuff. So we can put it all in one pot if we wanted to. Just kind of different missions at the end of the day.
Sure.
And how and who is actually funding and providing the services. But we can look at that. It's if you'd like.
Wellness just seems like HR to me. That's just where my brain goes. I don't know if you will. I would love to hear from council.
Yeah, wellness I associate with HR as well.
Yeah, I don't know why we would take that out of HR's a pocket, but like I said, I just we want to do the professional development. We want to do the employee assistance. We want to track all of that, and that's you all's role.
We try healthcare, mental health care.
Yes,
Yeah.
Exactly. Yes. Okay. Just go.
Everything else seems pretty straightforward. I like it.
Just want to make sure I understand what you were asking is if instead of it being live in the mayor's budget, you'd like it to live in the HR budget.
Makes sense. I was going to say, I think that makes sense because that, work in tandem with the trainings and things like that as well. I mean,
Oversee all of it.
right.
and I mean, should you have a handle on the PDs to keep track?
Theirs, I might keep separate
Okay.
just because theirs is a little different.
Okay.
Yes.
Specific, isn't it?
Yes, correct. Yeah.
I mean, regard to the wellness programs, I guess anybody could still do an initiative.
Yes.
It's not like you would have to
No.
but you would just manage the
funds.
paperwork and the funds for all of it. Okay.
Yeah, just if you all have the professional development, it kind of works in tandem. You all are able to kind of see that and manage it. I think it makes sense. So I would like to keep that.
Okay.
Keep it there. Okay, thank you for that.
Sure.
I'm sorry. I think they still have a Thrive committee, right, Andy, that meets to decide on the events and such?
Yes. So it's easier for you all to track it in HR. It was my choice to move it.
Oh, okay.
Specifically because that accounting is managed by our office. Because we are the mayor's office, our executive administrative team has access to all the accounts, can do the coding, can do the purchasing. We do that. So it's instead of them going to HR's account, invoicing, coding, purchasing on their behalf, it was just easier for it to live in our account because we manage that right now. It's not managed by our benefits specialist. Now it's managed by our office. However,
Shouldn't the benefits special?
she's part of that.
Yeah, yeah.
But it's one of the special projects assigned to Jesse. However, it's worked so far. We can make it work.
I'm sorry. I want to pause. I want to make sure are the cameras all recording? I don't see the camera there that was there yesterday. Are we all squared away for?
I think you said that they were reporting, yeah.
Okay, let's take a brief recess. I want to make sure that we are good to go. I don't see the same.
We're good.
Okay, we're good. Okay, sorry. I just want to make sure I didn't see the same one that was there yesterday. I want to make sure
We got the green key.
that was good. Perfect. Good. Okay.
Get the close up
Before we
this
get
time.
let's do it all over again. No. Sorry, Mr. Kids Pro.
As I was just mentioning, right now on the portfolio for our HR specialist, she's not managing this, but assisting with it. So our Thrive initiative, our wellness thing, is broken down into two buckets. One is dollars that we allocate, the $12,500, and then there's Care First credits. She assists with some of that. So we also receive money, an allocation of credits from Care First. So it isn't done in tandem, but if it's easier for everybody to see it in HR,
Sure.
it's a council level adjustment with finance. We can just move the money back into that account. It's pretty easy.
I'm not trying to be difficult. It's just, if you see here, there's a lot that is going on. We have duplication. We have, things that are similar and not similar. And so I think for it in purely the accounting part, and then of course there's money going here, there, and then for the public. So, I mean, I understand the executive office and you all control the administrative portion of the city, but we have an HR department. They should be controlling everything that deals with human resources, professional development, the wellness of our employees. Also, the employee that we have as a benefits specialist should be managing the benefits that our employees receive, not someone in the mayor. I mean, I respect that. I'm just saying, again, for the accounting portion, for tracking the funds, for all of that, with government. I mean, that's just how I would love to hear from council. If it's not, if it's pedantic, then
No, I think that makes sense. And I actually had another question as well about the pantry with that wellness. Is that something that would be managed by HR?
We no longer run the pantry. We do take-home meals quarterly as one of our initiatives, but we do not have the pantry in operation anymore.
No? Okay. Is there a specific reason why we're not doing that anymore? Or was it complicated? I mean, what was it?
Complicated, cumbersome, not utilized the same way, so we just suspended it.
Okay.
So in answer to your question to Sean, Andy, then you are in the executive, the two of you, you and the mayor, are comfortable with having this lumped together, or do you have another recommendation for grouping it? I think what President Doherty is saying is you have it in all these little pots. If we put it all in one pot, where should it fit in that one pot? That makes it easier for you as well as for Sandy.
Right now, in this current fiscal year, it all lives in HR's office.
Okay.
So it would be just continuing as the same. It is as simple as we just write the different code down on the paper when we sign the invoice. It's simple enough. So if it's easier and more transparent, we'll just leave it where it is. And that's just I think finance over there has made a note. We'll just shift it over.
Yeah.
As long as the funding that is allocated is fine, the 12,500 for that, we seem to able to use that to do a lot of great things. So
Okay.
Can we? I mean, do you all want to see the pantry or that? I mean, was that? I wasn't here during that time. I heard about it. I know it was at HQ, correct, in the basement. Was that something that employees took advantage of? And
Yes, they did. It started out really good when I was here, and then some of the donations, they dwindled, and then
Okay.
people just stopped coming.
okay.
Where were
The
you
biggest
getting
issue.
donations from?
The Maryland Food Bank was our primary place, and they stopped. So we lost so we were paying a lot of money per month. We were buying it all. Yep.
It's not headed here anymore. It's headed from Baltimore. So in order to get invested in it, you have to go online and fill an application for that, because the VFW was also doing it as well, and they want you to partner with them. And last year when I tried to, it was so many people, and they want you in a certain area distributing food. But I think this would be a good look for the city of Salisbury to be able to do this for their employees, but that's where you have to start from.
Okay.
Yeah.
I think it needs more than one person, because I think before also we had only had one person operating it as well. It's going to need multiple people, working together to get this done. And I think I know the council would love to volunteer. I'm going to voluntold you guys.
Well, do they? Let me ask you something. Were you tracking what was going out, or was there any information that had to be signed? Because I know a lot of times with the Maryland Food Bank, there has to be a signature. If you're taking food out and it's distributed from the Maryland Food Bank or any government entity, it has to be tracked. In case there's food poisoning or whatever, then it has to be some way that you can get in contact with the sources or the people who are taking this food home with them. So
I think the equivalent was to do these take-home meals. So instead of having a pantry, we were just reversing it. Everybody could participate at some level, and people that really needed it took it home. I mean, that was sort of the model, sort of a replacement model. It wasn't an elimination. It was just a replacement model.
That's what I saw. It was like the lasagna or the
So who cooked the food?
you had to cook it yourself.
Yeah.
It was like a take home lasagna thing or something.
Well,
Yes. There was a pizza kit recently.
Okay.
burgers, we do hot dogs, we do. It's been like you do.
Okay.
7 or 8 of them a year, I think.
I mean, if that works, it works. But
Yeah.
I was just trying to explain to you
Yeah,
how
sure.
to go about getting that food distributed to the city.
Councilman Gregory, I know that this was a.
Yeah.
What are your?
I would like to see us, bring it back if we can, because I know that there were a lot of folks who it helped out.
Would you see it to start with to put some funds in there to get it kickstarted, just so you wouldn't have to rely on the food bank in case there was a
Yes,
a deficit there?
that would be helpful.
Yeah,
Council, would you?
I think that would be good. I'd be.
Council,
Honestly, my view on that is, if somebody was having, if they're in a situation where they have a food shortage, I'd like to correct the problem through their pay. I mean, there's a problem.
There's also other reasons why
Yeah.
I can speak to the fact. I mean, I know when Nick was hospitalized, these guys all pooled together and bought dinner for the family. And that helped us out immensely. That's something like that. So there's other reasons for using the food bank as well when there's a family in need. Kids get sick, things like that. getting to the grocery store isn't always easy when you're dealing with a family situation or emergency. So I think, that it's beneficial in those ways as well. I agree with you. I do. That, ultimately increasing the pay is the goal.
Was it utilized as much? Because I know how some people are. They don't want to go because it's a shame.
No, people, they were not ashamed to go and use it.
Because I
they
know how
truly
some
weren't.
people really are.
Yes,
I'm
yes.
not going to go because somebody's going to talk about me.
Right.
Say something
No.
about me. So,
No.
if it's properly utilized, I would love to see it come back because times are hard right now. And people need that reinforcement. They need that help. So I would really love to see it come back because going in the grocery store and having to buy eggs for $13 and $14 a dozen or a dozen and a half is a lot for some people, especially when they have kids.
So, and so this ties into our conversation yesterday with retention. I know we focused on PD and field ops. I asked the question, but these are the small things, but it could mean a lot to to different employees. Where again. I didn't have to stop for breakfast this morning because we had, but so it's those things where, okay, if I can go here and, grab this, and it's able to help, skip one meal with my family, that's going to save me $40 or so. So, and it's something where I can go, no one's going to watch me. It's just to go and take that there. And it's something that it's, to our budget, it's very minuscule. So I would like to see us,
Did you hear him say $40 for a family?
For one meal.
For real?
Well, okay. Well, sorry, my family, me and my four, me and my dog. But no, so and again, it's saving you, dollars, so to put here. So I would like us to miss the point, Councilwoman Jackson.
I understood what
So what's a dollar amount that we should start this fund with? Again, I would like to see us utilize our community resources, and again, we can do. I know there's a pantry across the street at Trinity that they have there, and we can do some things. But if we can kickstart it, that would be something that I would like to see us do. So what's an amount that you all would like to?
I would take a recommendation because I don't know how much they usually would put in.
President?
Yes.
When we were when we no longer were able to get food donated from Maryland Food Bank, we were placing orders on a monthly basis, and we were spending about $500 per month.
Okay.
So that's about $6,000. There is an additional level of complication from a staffing standpoint. It's either it's free range. We don't have the staff. That was also an issue. We're not going to monitor it. We're not going to have people standing down there going to it. It's kind of come and go. There's limited hours. So there's all these other complicating factors. We also sent out a survey, and the overwhelming majority of the survey said they'd rather do take-home meals than the pantry. But we can do both. But from an allocation of funding, if there's additional resources available, then we can explore doing both again. But
where do the take-home meals?
they live in that same $12,500.
So if we just
Petition 25.
put more,
If we
put
put
more
more
funds.
funding in there, we could explore that opportunity again.
Thoughts?
I think that's a good idea. I like that.
I mean, just to know, Mount Air, Easter, and Thanksgiving, you can call them and they bring meals.
Well, yeah.
Bring box meals for
Yes.
families.
Yes. And again, we have our partners with 50K Souls. Again, they have the boxes there. We can partner with them. Again, the pantry across at Trinity, they with the resource center there. So again, I like you said, Councilwoman Gregory, she volunteered us, so we'll help out. But this is, again, like I said, I think this is a good program. And if the employees are saying the take home meals, and let's just stick with that. So we'll put we did $2,500
I think-
more or in that account, or what's?
I think
I just said when we were ordering food, it was about $500 per month.
And right now, how many take home? You do it quarterly?
Yes,
Yes, quarterly. And for how many employees?
around 120 each time.
So, wait, I'm confused.
Out of this 12.5.
Hey, Jess, you want to come up? Talk about this?
Is this
Go ahead.
is this contributed to the entire city? I mean, to the city workers, everybody. All the city employees.
all the city employees. Yeah.
Okay, how many employees do we have?
What? Just under 500?
Just under 5, yes.
Yes, just under 500.
5.
Could you tell us? Okay, so could you tell us the frequency that the with the take home meals, and then how many?
Yeah, Jesse Turner, Mayor's Office. Take-home meals, we do quarterly. It's on a schedule. We kind of map out the year in January. And it is, we've done pizza, sloppy joes, chicken pot pie, spaghetti.
That's the emails we get. Yes.
Yes.
Okay. Good. Okay.
Yeah.
All right.
And so then, in addition, also kind of quarterly, more in the summer because we have the ability to grill. We do our employee appreciation lunches. So hamburgers, hot dogs. We just did a ham lunch for kind of Easter spring. We do spaghetti, and we have, oh goodness, around 200 participate in those. That's at lunchtime, and it's just people can come and eat here, fire station, or they can take them to go. So we also will deliver to like the overnight shifts at the water plant. I'll take meals there for PD, fire. So those two things I think have been more successful than the pantry. Cost per employee to serve a lunch is around $2 an employee. The take-home meals are a little more, 7 to 8. But the pantry on average, because we had the same 20 people coming, so with the other two options, we can serve more people at lower dollars.
It's manpower.
So the average with the pantry, I think it was about $15 per person. And I have all the statistics. Had I known you were going to talk about it, I could have given you that.
No, that's okay. It's just it popped in my head when we were talking about the wellness. So
Yeah,
I think we're
Mayor teases me because a lot of what Thrive does is food, but people like to eat.
yeah.
And, a free meal and a chance for employees to get together. Because I
The morale booster.
Very successful. Yep.
Yeah.
Those are good.
There was some corn and apples.
Just saying.
Yeah. There you go.
So then, Jesse, you would, what I'm hearing you say is that if we stick with the plan that you're doing, you have it, it's down to, you fine-tuned it, instead of manpower and manning and supplying a pantry,
So
to continue with what you're doing
it just
because
serves more people in a
Yeah.
more cost-effective way, I feel.
Right. there's a
More employees
camaraderie too,
participate.
possibly, yeah.
With the pantry, we weren't delivering food anywhere. It was, people had to come to the headquarters building, go to the basement, limited it to one bag. But I tried to, when I did it, tried to buy and according to like meals. So, have all the ingredients for, say, tacos or spaghetti and then just staples, pasta, stuff like that. But, people have to come get it. And so it's a little bit different, I think.
Sure.
And just didn't reach nearly as many people as the other two options do.
Okay.
And then we have an entity also as well in this actual community that does do that, and that's Emmanuel Wesley. They do it. So if we could get some kind of information out to the employees, if they needed food, they could go out to Adopt a Block on Benny Street because
Yeah,
they
Adopt
do
a
have a
Block, yeah.
very, very large pantry. And that will save the city, and then we could do the outreach as far as the take-home meals that you're talking about right now. That would be better. Then it will take some of the liability and work off of the city, and just
And I know that the storage and moving of stuff was a major problem.
Yes.
I know before with the pantry. So that was
It's a lot of work.
yeah, it's a lot of just the physical work of it is just hauling, all that canned goods and things like that.
the
That's a
Adopt a
lot.
Block is just not for that particular area. It's for anybody
Yes.
who wants to go and get. So that's a resource that you can get some brochures from, and just give them to the families in time of need. And they have nothing to feel ashamed of or anything, because that place is a lovely place to go get anything from. And just, you already know.
It's set up in such a manner,
Yes.
everybody, it's like a
It's like a
grocery
grocery
store.
Such a nut believer, and so we can try to stay on our time block today. I was looking at the actuals. It's about just under $9,000 for last year. I would suggest just moving the account to 15,000. It's an extra 2,500 there, and then that gives you a little extra boost. You didn't utilize all the funds from last year, so that kind of gives you that little boost there. So you're able to do the take home meals a little more frequently versus just quarterly. Does that sound?
Yep.
So you have
Council?
the what? Yeah.
So that
What line are we looking at?
the 502021 account wellness. It was budgeted for 12.5. Actuals are 88.70. My suggestion to move it to 15,000. You're going to give them essentially an extra just under 6 there. But we're going to budget an actual $2,500 more than what the proposed budget
Yeah.
is.
Okay.
Does that make sense, sir?
That makes sense.
Cool.
I like that.
Okay. So we want to see those sloppy Joe meals a little more frequently now, but that's good. Thank you, Jesse, for chiming in on that.
Thanks, Jesse.
All right, Ms. Keaton, thank you.
Yep, sure. Advertising, which is 555,501. Basically, we asked for an increase, and this again, streamlining. It used to be the departments would manage their own advertising. Now that we have a recruitment specialist, we've asked to streamline it and everything live in HR.
For job posting.
Yes, correct.
Cool.
Yes,
And I've
exactly.
seen, yes, you all have been much more active, so thank you all for that.
Yeah,
Yes.
absolutely. Thank
Yes. I do have a question. It's not pertaining to this. It's with the insurance. I know we spoke before about insurance and kind of, is that something that you all help and handle? Who are we with?
Care First.
Yes. And with, how is that looking and with the, yes, the increases and the credits that we receive, all of that. How does that all kind of pan out?
I believe for the increases, we've budgeted for 9%.
Okay.
We have not received the rates from from Bolton, our actuaries yet. Hoping to have those very soon, hoping it's around the 9%.
Yes.
Some other municipalities have not been that lucky, so
Okay.
I'm keeping my fingers crossed.
Is that provider like the best we can do? I mean, is that like kind of standard? Because I know that's generally what the government goes with. And
Yeah.
I just also know that places like Johns Hopkins have cut ties with.
Yes,
so those
Hopkins
are-
has, yes.
That's a frustration on my part too. Right
I
now,
am
'cause that's what
sure.
we're dealing with, but Johns Hopkins has cut ties with them, so
Yeah.
that people who have that insurance are not going to be able to access care there. Yeah, that's unfortunate.
I know you may think I'm crazy, but I see the blood bank, and that's one of Angela's things. Do we give incentives? Blood bank?
No, and honestly, Andy, can you talk to that? Because I'm not really sure. It has $3.75.
I think we asked about that last year too.
Yeah.
Breaking the bank.
The blood bank, I think it was just an error. It was something that came over like old deductions from payroll because we used to be a member of the blood bank and took deductions. I think it was like $5 a month for
So yeah, you just see the account because of the history that exists with it, but we don't do anything directly with
for
the blood bank.
FY26.
Plus it closed.
Yeah, it did.
Two things, Ms. Caton. Can you talk about the background? I know that was was in the mayor's proposed,
Yes.
the mayor's allocations, and also the safety 26-7. Can you speak to those? two
Sure,
things?
absolutely.
Thank you.
I'm going to ask Kelly, our HR specialist recruiter, to come up and she can speak to the background checks.
Good morning.
Yeah.
Morning, Kelly Jones, HR recruitment
Yes.
specialist.
And thank you. I've seen you post on LinkedIn and with all those. So thank you. You are pushing them out. We appreciate it.
Good, glad you see them. So background checks, currently right now, we are not running background checks on anyone for the city when hiring them. I'm new here, so I don't know what the, previous practices were. What I'm understanding is case searches were done. So, as we're hiring someone, we're looking on case search.
The departments are?
Yes. Well, they are not now, so that has stopped. It's all going through me at this point.
Thank you.
But yes, that's why I'm here, to help streamline everything. So my request was that we run background checks on folks that we're hiring. So that is what the additional funds are for, would be both background checks and also MVR records.
Yes.
Because currently, we need those for most of the positions that we have here require a valid driver's license, because a lot of the folks are driving city vehicles or have access to that. So
Meaning, and then this is like every other, so you put the person's information in the system, the software will then do the work instead of the person making a judgment call, yay or nay.
that's correct.
Thank you.
Yeah.
My goodness.
Yeah, I mean, it's going to do like a nationwide criminal background search. So
Yes.
It's not like right now where we could only capture like maybe the state of
State of
Maryland,
Maryland,
states that
yeah.
have public records, but, if we have somebody that comes from another area, we may not have access to that information.
Thank you.
Thank you so much. That is huge.
I agree.
Just to clarify, we were doing background checks on law enforcement officers.
I was gonna,
Yeah, so like
I'm trying not to ask
universal
questions that-
background check.
I'm sitting here and there's
We don't know who
17
these
questions
cops
in my
are.
head.
No,
but
yeah.
Yeah, they
So,
have their own problem.
Yeah, there is a
Anybody who
we are standardizing and having a universal background check system so that we know of everybody. There are some
or just new
requirements.
employees, or is this going back?
This would just be new employees. That's what the funding has been
Okay.
requested for.
Although I'm doing Andy's quarter.
Yeah, he's got to keep up.
say, I don't know.
Daily.
Oh my God.
Man, don't touch it.
Fingerprint analysis.
back in.
But let me ask, I've got a question about that. Now, and I know you're doing for new hires, but suppose you've hired somebody already that has a criminal background. How do you deal with that? Because if I'm going to get a background check and I find out that somebody else is here that had no, that has a criminal background,
Right.
I'm going to feel some type of way because I'm going like, how did they get hired? And I know the process wasn't there, but then I don't get the job because I do have a criminal background, but they have one too.
I'm surprised legit hasn't. It's not a mandate or.
Certain positions require it. If you're working in childcare, for example, some of the safety sensitive positions require additional level of screenings. We were looking at doing this universally for everyone. Again, we've not gone down that path of doing background checks. We haven't had that conversation of making sure we have a background on every employee right now.
Like a
That
finance
number would not be
department,
enough
right?
money.
So like the finance department, are they under any, do they, not to put you on the spot, sorry, just because I worked in, I mean, you did too, Mayor, so you know like the qualifications that we have to go, I mean, they get pretty, but this is good, but I guess what Councilwoman Jackson is asking is.
Yeah, how do you deal with it?
So essentially, a couple things. When you do backgrounds, if you do a case search or do an immediate search on somebody upon hiring, which we've been doing, that is a moment in time. So we get a snapshot of everything you've done in the past. The whole purpose of having a criminal background check at a federal level is to see what happens across the country, but also if there's an infraction that happens while employed, we will be notified that something has happened moving forward. That's the purpose of the background check, not necessarily a look in the past. So I feel pretty comfortable with us looking in the past upon our hiring practices, but it's the idea of making sure we keep up with whoever our employees are. Secondarily, I don't want to say just because you have a mark on your background that it is a disqualifier for employment. It depends on the position that you have and what the infraction was and when the infraction happened. So if there's financial impropriety, you probably won't work in a finance department. But if you have a speeding ticket, we're probably okay. So it also depends on what type of infraction is and when it happened before we are telling people they can't work here anymore. So
Speed, so you're good.
I was
yeah, so you.
Council President.
But after 10 in a week, so.
On the way here, no. Okay, that's good. Thank you for it, because I had a question
Yeah.
about what that was. And then the safety 26-7.
Yes. So
Thank you for your work, Ms. Kelly. Yes.
this is something new. This would be an annual service contract for safety management. This would be a third party that would do consultations for inspections, training, health and safety programs. They would come in and they would assist the risk manager should MOSH pop by and we are not doing something we should be. We could call safety resources. They would come in immediately. They would know how to handle the issue, how to get it correct going forward. They will do safety and health programs. They do training. They'll assist with the inspections. And then this also, for legit purposes, we would have a cost savings.
That was my next question. Oh, man, you guys are mind
You were going.
Perfect. Thank you for that.
Yes.
Anything else, Ms. Caton, on these items here?
No, that's it.
Council, any other questions?
No,
That's it. Thank you so much.
Thank you, guys.
Thank you for your work. We see what you all been doing. So again, thank you again to the HR department.